Hello and welcome to the Nature Unplugged podcast, where we are all about inspiring wellness in the digital age. Let's get going. All right, well, welcome to the Nature Unplugged podcast. I'm super excited for this episode. We have a very special guest. So here at Nature Unplugged, we are all about inspiring wellness in the digital age. And I look at a lot of the work we do as preventative or upstream mental health work. Things like getting outside, setting healthy boundaries with technology, exercising. And our guest today has dedicated his life to helping people with addiction, recovery, and mental health issues. We have the privilege of speaking with Dave Marlon. Dave is here to share some of his story about addiction and recovery and what we can do to improve our mental health, whether we're dealing with addiction or not. So Dave, welcome to the podcast. Thanks so much for being here.
It's an honor. Thanks, Sebastian. I'm looking forward to speaking with you.
Yeah. Okay, cool. Well, me too. Well, before we jump in, I want to give people a little more background. So I'm going to read some of your bio. You have an awesome bio. I'm going to read a part of it. Okay. So Dave Marlon is the co-founder and chairman of Vegas Stronger, a Las Vegas nonprofit committed to helping the most underserved in our community by addressing mental health, substance use disorders, and getting back to a healthy, productive life. He has been honored with the Mayor's Commendation and just recently received the Community Counseling Center of Southern Nevada's Vanguard Award. Dave received his education in New York and Las Vegas. He earned his BA in economics at the State University of New York and his master's of business administration and master's of science in clinical mental health counseling at the University of Nevada, Las Vegas. A lot of stuff. Furthermore, he is a certified alcohol and drug counselor supervisor, a certified addictionologist, and detoxification technician. Dave is also currently pursuing his doctorate in psychology. Dave is an active Nevada amateur boxer, which I love, by the way. Yep, and an avid mountain climber and triathlete. Despite his active life, his primary role is as father to his teenagers, Owen and Tristan, and husband to Carolina. It's awesome. Great bio. And I just want to say, too, on a personal note, I've known you, I don't know, for 8 or 10 years or something like that. It's been a little while. Started out, I met you through working with your son, doing surfing, yoga, and that kind of stuff, Owen. And I just got to say that you've been an inspiration to me. We live in different towns, so we don't see each other that often, but the things you post and every time we have a conversation, I'm inspired and want to be a better person and better at what I do and a healthier person. So I'm really pumped to talk to you, and thanks for taking the time and thanks for doing what you do.
A pleasure. I appreciated the years of work you did with my son. You helped light a fire under him to really enjoy the water, to really enjoy surfing. The stories of your dad as a competitive swimmer, the stories of you as a competitive surfer, and some of the things you do to take surfing to another level. Integrating yoga and flexibility. At first, it seemed like two totally different sports to me. But as I got to watch you teach my son more and more, I realized how integrated it all is. And the fact that you acknowledge that it is just as much mental as it is spiritual, as it is physical, really helped open my eyes to some beauty of surfing. And while I grew up bodyboarding or body surfing on the East Coast, right. Seeing my son really light up on the waves is something I'm forever grateful for you for introducing to my son.
Well, thank you very much. Yeah, you're very welcome. And he's awesome. I'm excited to catch up more about him too. And it's really, I was really drawn to him because he grew up early years in Vegas, right? And then he kind of came out to San Diego a little bit later. So, a lot of the kids he was with were surfing from the get go. But he was tough and ambitious, and I really enjoyed our time together in the water.
Cool.
Cool. Well, I want to start with a little bit of background. I shared your bio, of course, but how did you, if you don't mind sharing a little bit more about how did you get involved in this world of helping people with addiction and helping people recover?
Thanks for asking. My story as a kid being raised in the '70s and the '80s. I went and I got a degree in economics, and I learned that the answer to life was to become a CEO and make millions of dollars, and that's really what I focused on trying to do. And I left New York at 23 years old, and I took a job at an insurance company, and I worked in progressive jobs over 20 years till I became CEO. And and I thought that I would have then grabbed the brass ring, and I was successful. I bought a house down in Del Mar.
Yeah.
So I had the beach house, and I thought that that was success. But there was an emptiness inside of me that I ended up filling with drugs and alcohol. And I ended up having a burning bush moment um, with my son actually being part of,
Mm,
where at the time he was 3 years old. And I recognized at the time I thought I was possessed because I couldn't rationalize why I would prefer to go drink or use rather than be with my kid. I could convince myself that his mom was a nag. That was very easy to do. But my son was perfect. He was 3. So I ended up going to a rehab, and I didn't know what it was. I didn't know how it was going to work. It seemed weird. I got there. I generally didn't like the people. But fortunately, I was kind of out of ideas because Dave's way, despite my hard work, Dave's way wasn't working. So I recognized I needed to find a new way. And I had become beaten down enough to be open to something else. And, during the rehab process, during the integrating into a 12-step fellowship, I ended up becoming open to true spirituality, to a higher power. And I ended up not needing to just stop drinking and using drugs. I needed a whole new system of living.
right.
The whole 1970s get more.
Right.
I learned the flaw with it, despite the fact that I remember arguing with, religious people about how, I live in a big house and I could have anything I want, my way must be better. And I ended up seeing how thin and how empty that was. So I got sober in May of 2005.
Wow.
And I really began. I've had 2 lives. I had this one life till then. I've had this different life, saying to myself each day, how could I serve? What could I do to help my fellows? And recognizing that by being helpful, by being useful, more joy comes to me than I ever imagined. I'm grateful that alcohol beat the snot out of me, and I'm grateful that I found a way, and I've spent my life since leaving the fire, running back in and pulling as many people out as I can.
It's pretty incredible, Dave. It's really amazing. And I resonate with your story, I think, and a little bit of my background about my dad. And so it reminds me a lot of my dad, and even though he didn't really, drugs and alcohol weren't his thing, but it was very much this, I think a lot of his, uh, he was fueled by this get like always more and more and more, stockbroker in the 80s, that kind of stuff. And then kind of reached this place and wasn't fulfilled and right and didn't really have the tools or resources to live the second life, right, which I think about
Mm.
so beautiful that you are have able to keep going, and impact so many people, which is really amazing.
Yeah, I ended up opening up a rehab shortly after I got sober. I left the insurance company. I opened up a little 10-bed rehab. And over the next, it was 13 years, it grew to be a 400-bed treatment center. Uh, I've now helped 9,000 people in Sin City, Las Vegas,
Right.
get separated from drugs and alcohol and begin a different life. And, the little story I tell is when I left the insurance company, my last 3 years there, my W-2 said I made 7 figures a year. So to me, in my prior Dave, no one was going to say, I wouldn't say I wasn't successful, but I was empty.
Right.
And then the first 5 years of running the rehab, I lost money every year. It was zero, or excuse me, negative.
Yeah.
And without a doubt, it was the richest I'd ever been.
Mm.
Anytime I would go to the shopping center to get milk, I'd be walking through and people would stop me and be like, thank you so much. My wife's back. Thank you so much. Our daughter, is back. Thank you. And to me, that's rich.
Yeah.
That's useful. And right now I'm trying to leverage my 20 years of insurance work now with my 16 years of recovery work to really do something scalable in Las Vegas to help our most vulnerable population.
That's amazing. Yeah. And can you speak a little bit more? So you're still doing similar work, but you're now with CrossRoads. Is that sort of what you're talking about, the scalable thing to help?
Um, about 3 years ago, a guy, John Seelan, and I opened up Vegas Stronger. And we were working there and we had applied for our licenses and we were kind of waiting because it takes a while to get paneled with insurance companies and approved by state and federal licensure folks.
Right.
And while we're waiting, the board from CrossRoads, which is the indigent detox in Las Vegas, came to us and said, hey, would you guys come? And we're about to close. We're bankrupt. We lose so much money every month. And we were like, no, we're doing this Vegas Stronger thing, trying to help the indigent get well. And they're like, well, we're the detox doing it. And I was like, wow, there's probably a way to integrate and do both. So
Wow.
John and I came over almost 2 years ago now. So I have two jobs right now. I'm the CEO of CrossRoads.
Okay.
And that's 182 bed, 24/7 indigent detox. And the CEO of Vegas Stronger, which is an outpatient mental health and substance abuse treatment center that really operates in like a clubhouse model where we're welcome to folks who are in the shelters to be able to get behavioral health care.
Wow. It's awesome. Yeah. It's really amazing stuff that you're doing. I could go on about that. And I want to just shift gears a little bit to here. I know we're kind of coming out of this really difficult phase of the pandemic and stuff and COVID. But I'm curious to hear from your perspective, and with your work, how has the last couple of years been? I imagine we're seeing higher instances of substance abuse and addiction and all that kind of stuff. Is that been the case for you all?
Dramatically higher. We saw in the pandemic initially alcohol rates, the amount of alcohol being purchased in America dramatically increased.
Mm-hmm.
I saw 40%, I saw 52% as numbers of increase in alcohol purchases by Americans.
Wow.
We also noticed Las Vegas or Nevada approved marijuana use. We saw lines in all the dispensaries. So we know, marijuana use spiked. I also had able to look at laboratory results community-wide, and the amount of substance use in the general population is much higher. So the amount of people using benzos, using amphetamines, using opiates, all three of those have increased dramatically during the pandemic. So unfortunately, an unhealthy coping mechanism that Americans turned to during the pandemic was substance use. And that is now a looming tsunami that is going to need to be addressed.
Yeah. Yeah. I mean, and are you seeing a decline as things open up, or is it still pretty intense with your work right now?
Um, we're busy. For the first time last month, we were full, and I'm looking at acquiring some other facilities so we could expand our capacity because we need more beds, we need more services to be available. Interesting story I learned
Yeah.
during the pandemic. Um, in March, I have 22 licensed clinicians that work here and 8 case managers, and they immediately went to telehealth
Okay.
where our clients began getting their therapy, via a computer to keep my staff safe.
Right.
What happened was one of the measures that I check on a daily basis is the clients that leave against medical advice. Because
Mm.
I've learned that if people go to rehab and they leave early, 100% of the time they relapse,
Okay.
despite what they say.
Yeah.
So to me, if you check into detox to get off heroin, it's very important that we keep you through that process if we would like a successful outcome.
Right.
Well, what happened was, as I try to keep that number below 5% every day.
Yeah.
And when we went to telehealth, despite our efforts, our AMA rate spiked at 27%.
Wow.
And I recognized that the lack the lack of therapeutic relationship that we were establishing on the unit had degraded so much that we weren't able to keep people in treatment. So despite it being unpopular, I made all my staff get out of their pajamas and come back to work.
Wow.
Because as close as I feel talking to you here, it's different than
Oh,
being in person.
yeah.
And I actually got to see a real life example of that during the pandemic.
That's a wild story, and I think our take on this too is absolutely, we're not anti-tech. There's a place for this. There's a place for Zoom, and certainly in the last couple of years, it's been a lifesaver for education and all, and the ability to do some therapy and some treatment. But I think, as you said, like that's my take is like there's never going to be a replacement for in-person human connection, and I think it's that's wild to see the data shift so dramatically, and then
Yeah.
yeah, and you making the change to get, I'm sure it wasn't popular, but getting people in the door.
Yeah, it was interesting where, I got threats and it was very unpopular for about a week.
Yeah,
And then they just adjusted to the new norm and homeostasis arrived and, oh, wow, you go to work. We had PPE, so people were able to stay masked up and,
yeah.
sanitizing. And I hired some extra housekeeping to keep stuff wiped down. And, fortunately, we didn't have any outbreaks of our staff, despite having 160 staff in this one building.
Yeah, that's great. It's interesting, and it reminds me of so in the world of, this is different. You're dealing with substances and alcohol and stuff, and sort of our world is a little more. It's like gaming and screen time and all that. They're not the same. But some people do talk about some like gaming and screen time overuse as addiction. And I was curious if you had, when it comes to alcohol and drugs, or how would you define an addiction for people, or people listening out there? Do you have like a way to characterize what an addiction is or not?
Two things. One, I believe it's the same.
Okay. Yeah.
I believe it's the same, and I call addiction compulsive use despite negative consequences. And that's the two-part test.
Yeah.
If you are doing something compulsively despite negative consequences, you have an addiction. And to me, you could put heroin in there.
Yeah.
Oh, I'm using heroin and it's hurt my body physically, my relationships. I'm getting arrested. It's hurt my job. We can go through all those. So most people will not debate me too long about heroin addiction. Although I do, get people come in and tell me that they're, I'm a functioning heroin user,
Right.
don't try to take that away from me. That's actually the only thing in my life that works.
Mhm.
So, a lot of my job is breaking down ambivalence to treatment,
Mhm.
helping people get awareness for their unhealthy behaviors and compulsive use of electronics. Um, is very similar. And I know, folks who we talked about today who it hurts their relationships,
Yeah.
it hurts their work, they're less healthy physically. All we could still go through that list of social activities, that it's compulsive uses and there's negative consequences.
That's it. I appreciate you sharing that, and it's such a good. I'd heard that sort of before, but not so simply put, and it's a good barometer to be like, because I mean that fits in a lot of the folks we work with too. It's whether it's gaming or whatever, it's impacting school or work or so. That's a good thing for any listeners out there who are like on the fence. That's a good
Yeah,
barometer
good
for that.
test.
Good test for that.
Yeah. Now, in the DSM, which is like the manual that categorizes,
Right.
addiction, there's an 11-point test which we go through.
Right.
And so it's a lot more detailed, but for you and for those at home,
Yeah.
you want to just ask yourself, am I shopping too much? Am I engaging in promiscuous sexual activity? Am I uh, is my eating a problem?
Right.
Are you doing it compulsively? Are there negative consequences? If so, you should probably take a look at it. And
Yeah.
usually, our own denial mechanisms prevent us from seeing it without help, which
Hmm.
is why getting, whether it's peer support or getting a professional assessment to help you see it, to get increased awareness, it can be so effective.
Yeah. Yeah. And I think that's also a good segue into. I'd love to chat a little bit more too about solutions. Whether it's devices or gaming or substance abuse or alcohol. What are and we've touched on this a little bit. But what are some of the most important things from your perspective in terms of practices for getting better and for recovery?
Well, my name's Dave Marlon. And since you asked me, the first thing I'm going to tell you is that in general, drugs are a lie.
Okay.
So if you're getting your neuroreceptors lit up by putting a chemical in your body, let's just acknowledge that that's a lie, that it's not real. That to me, having my son give me a hug, that feels great.
Yeah.
Having my wife know that I'm honest and I'm going to do what I say, and the love we have, that's real. Um, Me getting something from a beverage or a pipe, or in putting something in my body, it's a lie. And
Yeah.
and to me, I have found that an authentic good feeling is way more powerful. That's the first thing I'd say.
Yeah. Yeah. I love that.
The second thing I'd say is I have participated in the same support group for the last 16 years. And having outside help for people, when I tell them, oh guys, I got this great idea, it's going to be this, and they could just laugh at me, is so helpful because my brain will trick me. So having some outside help, um, I access it through a support group is really it's key for me. And there's all different kinds, and whether you're getting it from your church, whether you're getting it from Nature Unplugged camp, whether you're getting it from Alcoholics Anonymous, wherever you're getting it from, I'm not saying how you should do it. I'm just encouraging you to plug in to a group of folks,
Yeah.
to a group of humans who could give you feedback on your behavior on a consistent basis.
Mm.
It's very helpful.
Yeah.
Third thing I will tell you is actually the secret to life.
Okay.
And
I'm
while
ready.
I was in college, I used to take mushrooms and smoke marijuana, and I considered myself a seeker, and I was trying to find the answer. And
Right.
at first, I was a philosophy major, and I was reading Nietzsche, and I was trying to find the answer. And at 40 years old, I found it.
Okay, I'm ready.
And the answer is help others.
Mm.
That's actually the answer to life. It's like, while we're here on this planet, let's help our brothers and sisters. And by doing that, one, it gets me out of me thinking about my little desires and dreams and hopes and wants and why I was wronged. Get me out of all that and let me be useful in helping one of my brothers or sisters. I believe that is perhaps the best thing that I could do for my mental health, is being of service.
Yeah, that's awesome. It's we're just in the very early phases of this, but we've kind of started this bit of a pilot program on folks that we've worked with, kids that we've worked with in the past, going through the program, and then becoming guides, like guides in training, right? So it's pretty incredible though, with the few people we've worked with that they've gone through this. The shift that happens when they're all of a sudden, it's not just about them or their issues or their whatever, but being of service. It's then they step up, and there's this want to help and to step into leadership and all that. It's really incredible to see. It's awesome.
Yeah. I tell a story which is probably too long for here, but to
Yeah,
summarize it,
yeah, go for it.
I was coming off Denali, and I'd been up there for it was a 21-day expedition, going to the top of Mount McKinley. And
Yeah.
when I was coming down, I fell in a crevasse.
Oh,
And the guide who was in front of me on my rope team, he didn't see me fall.
okay.
He fell back and started sliding to me. But the guy behind me on my rope team, he saw me fall, and he kicked his crampons in, threw his axe in the ground, and made a 3-point anchor,
Okay.
which stopped me from falling to my death. And I use that example that I have a sponsor who I want to make sure I stay sober, because, one, I told him I would, and he's been helpful to me, but I also sponsor men behind me.
Right.
And it's almost more important on a daily basis that I'm not going to drink, because I'm not going to let those guys down behind me. So that, I usually tell that in a much longer
Yeah,
story,
that's
but having your students become teachers, that lesson in itself, that's the essence right there, where they start helping others and they get that joy and they start standing up a little straighter, and they recognize that they're a role model for these other people. That's everything.
yeah. What I want to, yeah, we'll do a deeper. I want to hear more of the Denali adventure at some point. That's pretty hardcore. You made it, obviously. So, and thanks.
I did, and I've done now 30 big mountains.
Wow.
My wife and I, just before we got married, we went up to base camp on Mount Everest,
Wow.
and it was absolutely amazing. It was just as spiritual as it was physical. Each one of us had our "I can't go anymore" moment,
Okay. Yeah.
which we had to work through,
Yeah.
which I happen to love.
Yeah.
To me, anytime we could get to that place of "I can't go," and then learn to work through that, ends up being super powerful.
Totally. Yeah. Which, I mean, this is a good segue too into, you've talked about it already, but I know that just from knowing you and knowing that you're a climber and all that, I know that connection with nature is a big part of uh, your personal life, and so can you share a little more about like how that plays a role in I guess you personally, and does it play a role in your how you show up at work and the work you do?
Yeah, we implemented experiential therapy
Oh, cool.
to the treatment, and I will tell you, it is so important that I could have people do all kinds of group therapy and individual therapy in a room, but I got to see the cabin fever that began to happen, and that when we would drive clients out to Mount Charleston or Red Rock or Lake Mead
Hmm.
and do an activity, um, it ended up being really powerful. And what sort of broke my heart is when clients would come back after 3 years or 5 years, and they would, talk about their experience. They didn't say, "Oh, my counselor, we really had a great breakthrough. Boy, the talk therapy we did." They say, when I went to Red Rock Canyon and I said goodbye to crystal methamphetamine and I let a balloon go,
Wow.
that they remember the experiential events hands down more than all the work we do. They don't talk about the psychiatrist or that we got them on a good medication. They remember the experiential effect over time.
Yeah. And I think, yeah, that's an awesome practice and story. And I think the combination too, obviously, the having the meds right, having the therapy, like those doing that deeper work, and then being able to, I think also the experience gives it's also a way to integrate some of that work. It's a really cool combination. That's awesome.
Yeah, it's important to to get outcomes, which we're trying. It's really in Sin City, Las Vegas, there's so much access to drugs, there's so much access to alcohol that to undergo a behavior change, the physiological separation I can do in a week or two. The psychological change, it
That's
takes
Dave, meaning the physiology that's like getting over the
if you're physically addicted to
yeah,
alcohol
yeah.
and you have the delirium tremens, if
Yeah.
you don't drink, if you get, gastrointestinal problems, you can't
Got
sleep, you're agitated, all those physiological symptoms occur if you don't have your substance.
Right.
We understand those and we can medically treat those in a week or two
Got it. So
and
that's pretty
have you
quick.
not go into withdrawal.
Yeah.
However, for you to change behaviorally, for you to change psychologically, it takes at least 90 days.
Oh,
For me, it was probably 2 years. It was 2 years for when I would stub my toe. My first thought wasn't Jack Daniels.
mm,
When that rush would come up
yeah.
into my brain and my, the primitive brain would be triggered.
Yeah.
I would still have those flashes of thoughts.
Yeah.
I have another funny story at 6 years sober, it might have been 7. I had my appendix removed.
Okay.
And I told the doc, and I'm there, and I'm running a rehab, and sobriety is my life. And I have my arm hooked up to the IV, and the anesthesiologist are like, "All right, we're gonna get ready for surgery here. We're gonna put this in." And they injected me with this sodium pentothal, and I was just fine. And as it hit me, I jumped up in my bed and I screamed "beer run" before I went out.
That is wild. So it's like reptilian brain stuff.
It is.
Yeah.
And it's really there inside me still. And I got to make sure I manage that on a daily basis.
Wow, that's incredible. It's like not even in the awareness. That's what a wild.
Right.
Yeah. Dave, well, man, I could keep talking to you. We can keep going, but I appreciate you being here. I really do. And I think listeners got a ton out of it. So thank you so much for being on here. There was so many little nuggets in there, and I want to circle back. A lot of times I like to give our listeners like a few tips or challenges, like 3 things to take away. And I think you named a few things, but do you have any like final tips, maybe 2 or 3 like little tips for people whether they're dealing with addiction or not, just to kind of strengthen their mental health and physical health?
Um,
This guy.
well, like I talked about with substance abuse, if if you're not sure if you're using your phone too much, write it down. Write down, I'm going to have my screen time at less than an hour.
Mm,
I'm going to write it down and see if you can do it. Now, write down, I'm only going to have 2 beers. Whatever it is, write it down and then do an honest assessment. And if you can't do it, well, that's insane. If you said you wrote it down and you're not doing it, then it's time to get some help from somebody outside.
yeah.
And there's a variety of counselors, whether it's at your spiritual institution or through your medical plan. Get some help and manage your addiction if you have it. We have this one experience, this one spiritual experience we go through in this physical form.
Right.
Why not maximize it?
Yeah. I love it. I love it. And for those who are just audio only, we had a little visitor. Who was that little guy or gal?
That's Biggie Smalls.
Biggie
He's
Smalls,
he's
huh?
a he's a dog, and he comes to the rehab every day, and he goes and meets with all the clients. He's a lover.
Biggie's a big, yeah, that's a big component. The connection, whether it's human or animal.
Yeah, love dogs.
Dave. Well, Dave, thank you so much for being on the Nature Unplugged podcast. And we appreciate you all tuning in. You can find our episodes on Apple Podcasts, SoundCloud, Spotify, wherever you get your podcasts. Be sure and check out www.natureunplugged.com for more information and resources. You can find our detailed show notes on the website. And Dave, I wanted to check in. Where can people find out more about you and your work? We've got people listening all over the place. What's a good place and I'll include in the show notes as well.
Well, first they should go to Nature Unplugged because you're the bomb. I'm at vegasstronger.org. Check out the website.
Awesome. Well, Dave, thank you so much for being on. We really appreciate it and look forward to continuing the conversation.
Likewise, I look forward to podcasts too.
Things change like seasons out of our control. If you think you should go, I will let you go.